Okay, guys, today we're going to talk about burnout. So, what exactly is burnout? Well, according to Johnson in 2013, burnout is a phenomenon that was coined in the 1970s by the American psychologist Herbert Freudenberger. He used it to describe the consequences of severe stress and high ideals experienced by people working in helping professions. Doctors and nurses, for example, who sacrifice themselves for others would often end up being burned out, exhausted, listless, and unable to cope. So, while the term burnout is not recognized by healthcare professionals as a billable diagnosis with a defined set of diagnostic criteria and treatment options, it is a generally understood state by those that are in our field of work. Feelings of burnout lead to underperformance on the job, feelings of exhaustion, lack of effort, the list goes on and on. It's a really unhealthy state for anyone, but maybe even more importantly, it's an unhealthy state for us, given that we're tasked with providing care to such emotionally unstable adolescents. So, what exactly is the problem? Well, presently, 80% of the nurses in our department are openly and actively searching for employment elsewhere, 20% of which are considering leaving the field of nursing altogether. The number one reason cited by each nurse for wanting to leave is burnout. With the increasing demands of everyday life, marriages, kids, finances, caring for aging parents, coping with loss, maintaining a therapeutic attitude in the milieu is already a challenge. Within the past year, however, our department has also been faced with the added stress of mandatory overtime to ensure proper nursing coverage per corporate standards. We have also been given an increase in our responsibilities despite any increase in pay or additional staffing within our department. We are being asked to do more with less, more frequently. The past year has also seen over 50% of our department re enter the educational setting in an effort to further our education. With most nurses working in excess of 45 hours a week, along with attending school and maintaining responsibilities at home, it's no wonder why so many are claiming to be experiencing burnout. So, hey, recognize this chick? Yeah, I know. Jokes aside, burnout can be especially easy to spot in our fellow coworkers and on our employees if we just take the time to look for the warning signs. Okay, so what exactly leads to burnout? Well, Erickson and Grove say that exhausted, discouraged, saddened, powerless, frightened, these are the emotions experienced by nurses on a daily basis. Recognizing that burnout is rooted in such intense emotional experiences is integral to specifying the facets of the work environment that are directly affecting nurses' well being and to effectively managing the hospital work environment in ways that can improve nursing outcomes. As I've already mentioned, our department specifically is short staffed. We have increased responsibility. We're working mandatory overtime. There are often feelings of inadequacy going around, and we're not having or taking the time to care for ourselves. It's actually a vicious wheel. We start with nursing turnover. People leave, you run into a nursing shortage, which causes inadequate staffing, which causes the people that are still there to become dissatisfied with their job. And that leads to burnout, which leads to nursing turnover again. It just keeps going and going. And without incorporating stress management techniques and other ways of preventing burnout, I don't see how the cycle is going to discontinue itself. Even though burnout isn't on the books as a diagnosable condition, it can lead to some pretty serious issues for the nurse experiencing the phenomenon, as well as the patients, employers, and families of the nurse. On an immediate personal level, burnout can lead to fatigue, feelings of depression, aches and pains, frequent headaches, weight gain, disengagement from family, work, and friends. When it comes to the job, burnout leads to tardiness, frequent call-outs, decreased job performance, and staff shortage from eventual loss of employees. At this point, you're probably thinking, wah, wah, bummer, right? So, how do we fix it? Well, as nurses, if we can't find the time to develop, let alone use our own coping skills and maintain some semblance of mental health, then how are we to best care for and set examples for the young men and women who've been entrusted to us? I think one way to ensure this happens, to get the ball rolling in a more positive direction, if you will, is to take some of the same advice that we give. So let's start with a schedule. All of our residents start and finish their days with a schedule, which allows them some consistency. While we may not be able to schedule our days from wake time to bedtime as predictably as our residents do, we can all still take a few minutes each morning to write down things we need to get done, something we would like to do, and then mentally prepare to work towards these goals. Also, setting aside a few minutes each week to look ahead at the time you have for work, family, school, and play allows you to plan ahead and find time to enjoy yourself. Also, seeing your accomplishments on paper or even on your phone can help reiterate that while you're tired and exhausted, it was all for a reason. Seeing that you are indeed getting things done takes away from the feelings of uselessness that often accompanies burnout. And by looking ahead each week for spare time, you're more apt to make use of it doing something to rejuvenate yourself, even if it is just getting extra sleep. And speaking of sleep, self care is of the utmost importance when it comes to preventing burnout. Even if it means learning to say no to extra shifts, taking the time to sleep, exercise, and eating nutritious foods are important to your personal well being. Just the same as we often stress to our patients, we have to take care of ourselves before we can focus on anything else. As nurses, we have to take the time to nourish our own bodies, souls, and minds so that we can sufficiently take care of our patients. Let me stress, however, that I don't suggest lying in the hallway to take a 15-minute nap during your 12-hour shift, unless, of course, it is written into policy and signed by your CEO, acknowledged by your director of nursing, and given to you in writing, of course. Speaking of your CEO, issues being written into policy, your director of nursing, on an administrative level, there are things that can be done to prevent burnout from affecting our nurses. According to Preventing Nurse Burnout, appreciation, acknowledgement, and recognition go a long way with nurses. And I don't think that our nurses are any different. Okay, so I'm going to go ahead and say it. I think it's time for a meeting. I know. Before you hit me with one of those, ain't nobody got time for that, let me just stress that I think that staff meetings are important. It's a really beneficial way of getting your problems out on the floor and starting the problem solving resolution. I personally feel like we should begin this process of prevention by holding a town hall style meeting to address the present issues of stress and burnout being felt by the nurses in our department. Following that meeting, I'd like to see each individual nurse set aside some time to meet with our supervisor privately. After individual concerns have been addressed, I feel the most pertinent issue to reduce stress and burnout in our department would be to adequately staff it so as to reduce the hours that we work and to put a stop to the swinging shifts that's been taking place for almost a year. Because the problem has been ongoing for so long without the issue being addressed by administration, I feel like giving a time frame for changes to occur would be appropriate. For example, if within 30 days additional hires have not been made to the department, the present staff will unionize in an effort to gain the help in making a safer, more adequately staffed work environment. So, we need more nurses that we have established. We need more predictable schedules. I feel like that following the issues of poor staffing, I would like to see the issue of poor morale addressed by initiating a monthly newsletter to be put together by the director of nursing, in which staff in the department would be encouraged and uplifted with positive information from the previous month. Shout outs for a job well done, recognition of birthdays or anniversaries with the company, and a simple acknowledgement of the holidays would be a good example of information to include. So last year, some of the nurses participated in decorating campus for Autism Awareness Month and decorated the office for the holidays. The doctor left us an hilarious note with oils, and we gave each other elephant style Christmas gifts. I think this creates a more positive work environment and helps us to feel more connected. Since feelings of disassociation are a key in burnout, creating a more positive and friendly space for ourselves actually helps prevent it from happening. I would also like to have an in service within the next month to discuss and go over key issues of stress management and burnout prevention. And I think that it should be taught by the clinical director or an appropriate proxy as deemed by the director of human resources. Look, as nurses, we're often so busy taking care of others that it becomes easy over time to quit taking care of ourselves. With the right self care awareness and administrative support, the issue of burnout among our nurses can be decreased, eliminated, and ultimately prevented within our department. With the ever growing nursing shortage in our area, especially in the field of psychiatric nursing, it is imperative that the issue be taken seriously and addressed in the appropriate manners for the sake of our facilities' retention rates, for the sake of our patients, and for the sake of our nurses.